And I would say, Dr. Kamath, now you've got your PhD degree for joining us. So he's a very dynamic individual, and I've known him for many years. I have the privilege of having him as my neighbor, so I'm indeed privileged. And today he's joining us. And so I leave it to you, Dr. Kamath, to introduce, because I know you've got a very strong CV and I honestly will not be able to encapsulate it. So since you've been working with the health industry for 3 decades, so can you just tell us a little bit about yourself?
Yeah, and what in short, I can say I've done the entire gamut of healthcare from A to Z, minus the insurance part. Although being in hospitals, I've dealt with TPAs, insurance companies, etc. But otherwise, whether it's pharmaceuticals, diagnostics, cancer centers, infertility, therapeutics, hospitals, I've done everything here, in short.
Great. So that covers the entire gamut, I think. So can you tell us what is your take on chronic diseases and its current impact on the population?
So let me put it that way. First of all, preventive healthcare in this country is an absolute infancy, is in its infancy, unlike the Western world, because as you perhaps preempted me earlier, here the concept of having preventive healthcare is non-existent. Because everybody, whether irrespective of the age group, they think that I'm fine today, I do not have any clinical symptoms. So as a result of which, why should I go for perhaps a test? Because the general notion, and being in healthcare, I've dealt with many people, millions of people and patients. So they think if I go for a test or a diagnostics, like maybe an MRI, a USG, a CT, then I will be detected and perhaps unindicated the doctor, because that's the general impression which this country has. Even if it is unindicated, he or she will drive me towards perhaps a surgery or hospitalization, whether it's medical or surgical management. So that's one part of the preventive health. Coming to chronic diseases, now the entire concept has changed from what we call non-communicable diseases to lifestyle diseases. And all these lifestyle diseases are dealt with either cardiovascular, neuro, psychiatry, brain. Now, earlier the concept used to be people used to think that if you go to a psychiatrist, you're mad. Not at all. I mean, you don't go to a psychiatrist today because you're mad, because mental health is also equally important. So these are all the kind of chronic diseases, lifestyle diseases, the kind of lifestyles that we and the next generation are having is quite different from maybe what one generation earlier that we had. So the whole concept is shifting towards chronic lifestyle diseases, by and large, concentrated towards the heart, brain, and maybe little bit like that.
Yeah, so more or less you are very much to the point. So chronic diseases, as we rightly call them, as a non-communicable diseases or the lifestyle diseases, they basically start out very early in life. So that is another significant point which most of us miss. So you could have maybe a preteen or a teen who is leading a sort of an existence which is not very healthy. But again, that is a terminology which is a very cliche terminology, which we say healthy, unhealthy. It's sort of like black and white. So nothing is black and white. We are living in the technological age where we are going to be sitting and doing Zoom calls. We are going to be on the gadgets. But what is the right way of doing it? That is very important, because many of these disease process. So if I were to say, you see, most of the people are on social media, right? So I have never been able to figure out social media. And I must say I'm pretty daft at it at some point. But when people are, especially the younger lot, they are on the social media, it does bring up a sort of a problematic social media user where there is a lot of stress and anxiety, which come up with it, because there's absolutely the situation of fear of missing out. So all those sort of things which crop up. So there is stress of career, stress of friends fighting, and so many other things, eating the wrong food, eating high caloric food, lack of physical activity. But again, as we said, those are some things which are there and we do it, but also things like blue light from the gadgets. So that suppresses melatonin. Melatonin is very important for sleep because it's your sleep inducing hormone. And if you don't sleep, Then again, these people get up in the night and again they are on their gadgets. So sleep goes for a toss. So, and we know that when sleep goes for a toss, that's when your body recovery is hampered. The cortisol level hormone, which is there, it increases, it causes inflammation, and the healthy hormones which are there, like the serotonin and the dopamine. The dopamine is a neurotransmitter that decreases. So it causes so much of tissue inflammation. That's why if you see during the COVID pandemic, a lot of youngsters got, there was in the third wave, Omicron, so many youngsters were affected. But it was not so bad. Like they did not require admissions, but a lot of them landed up getting diabetes and cardiac problems. So when it occurs at a very young age, the manifestation is not seen. So that's why they are called silent killers, and it comes up at a later point. So in your late 20s, early 30s, you'll get heart attacks. So in your mid 30s, you'll get stroke, early 40s stroke. So all these, and of course, as you rightly put it, mental health. Mental health also plays a very important role. Anxiety, depression, peer pressure, so many things come into the thing. And peer pressure, believe me, is not restricted only to teenagers and children. It's big time in adults as well. So these play also, if you see like cervical spondylosis, if you know, Dr. Kamath, we used to see cervical spondylosis in people in 40s and 50s. Now we are seeing that in the teenage group. Because of long hours on the medium, the neck is tilted, trigger fingers, trigger thumbs, overweight leading to joint problems. So the entire gamut of issues have cropped up at a very, very young age, So, so how do you think, like in this current scenario, what should an individual do? Like, what would you do to improve this thing? Like I'm sure you are there with a lot of community services as well. So how can you propagate it out?
So let me put it this way. Now, as you also said, earlier our lifestyles, slightly different, where we used to go and meet people, interact, everything. But today, the mobile has become the single largest screen for everybody, especially one generation next to us. Okay, for them. Now, you said about, maybe at night or whatever it is. I mean, I can see people on two-wheelers, on mobiles.
Yes.
Having the mobile in the ear and drive. So absolutely scary.
Completely
Forget
scary.
the accident part of it. As you said, cervical spondylosis. Exactly. And more or less because of social media now, it is trending towards sedentary lifestyles, which are the single most important cause for lifestyle diseases. There is no active lifestyle by and large for these people. They will watch football, they'll watch cricket, and they'll watch everything on the screen. They'll play Candy Crush, and they'll play all the games. Everything is available on the mobile. For us, it was maybe outside play cricket, maybe some colloquial, gilli danda, whatever it is. Everything is stopped now,
Yes, and that released also when you play, it releases serotonin, the happy endorphins. And that is the point when you get more motivated and you're in a happier state.
Comes to the mobile screen.
Right. So any final message which you would like to give the audience from your end?
No, I would say, frankly, now we ape the Western world in everything single room that we do, whether it is dress style, whether it is eating habits, whether it is watching. Why don't we imbibe a little bit of in the healthcare sector? We should inculcate the culture of preventive health. That's the single largest message I would like to give. If you are preventive once in a year, or people have a misnomer saying that I'm less at 35, 40, I cannot get myocardial infarct or a stroke. Is the other way. People less than 40 do not survive. The chances of survival are less than 10% in an MI,
Yes.
So please have an annual checkup done, irrespective at least about 25 to 30 plus, because you're more prone to and vulnerable to lifestyle diseases. And that's the only message preventive health is going to help you in the medium to long term.
Thank you so much, Dr. Kamath. And as you rightly said, the aging process starts from 25 years onwards. You know what is so funny? The human brain actually completes its maturation by 25 years. Okay.
Sure.
So when we say that the teenage body and the youth are, you have become an adult, but the brain completes the frontal cortex, prefrontal cortex, finally it matures by 25. So that's when the full brain maturation occurs. And from 25
Correct,
years,
correct.
the body starts aging. So this is such a crazy thing.
Sure.
If you see, the brain completes maturation and the body starts aging from 25 years, you start going downhill. And this is what I think
Perfect.
most of the people we miss out. So thank you so much,
Sure.
Dr. Kamath. I
You're
really
welcome. I wish you all the very best in your endeavors. Yeah.
thank you
Thank
so
you.
much. Thank you.
Bye.
Bye. Good day.